Hi everyone, thank you for making the time to join us today. For those who don't know me, I'm Nicole Wartone, the Senior Program Manager for Early Childhood Development at the Ian Potter Foundation. Before we begin today, I'd like to acknowledge the traditional custodians of the land on which we're all coming to you from today. And for me, that's the Wurundjeri people of the Cowan Nation. And I wish to pay my respects to their elders past and present, and also to any Aboriginal and Torres Strait Islander people here today. We've arranged this webinar today as the Ian Potter Foundation have been proud supporters of the Australian Child and Youth Wellbeing Atlas and formerly of the West Australian Child Development Atlas over many years. And we hope as a free resource, it will be useful to many of our grantees and partners on the call, working with children and young people and helping to inform your planning, scaling, programming and evaluation among other activities. The National Atlas launched in November of last year with the support of 23 different partner organisations led by Professor Rebecca Glout and Marketa Reeves from the University of Wollongong. Over time, the team will continue to build out the Atlas, adding more data and functionality. Professor Rebecca Glout is the Scientific Director of the RAIN Study and the Principal Research Fellow at the School of Population and Global Health at the University of Western Australia and has been leading on the development of this Atlas and the former West Australian Atlas since 2017. And Marketa Reeves is the project manager of the Australian Child and Youth Wellbeing Atlas. I will pass to them both now so that I can show you the Atlas in action.
Thanks, Nicole. Thanks, everyone. Nice to see you, not really see you. Hi, I'm Beck, and you can see Marketa there as well. First of all, I'd just like to acknowledge the traditional owners of the land in which I'm sitting on today, the Whadjuk people of the Noongar Nation, and pay my respects to elders past, present and emerging. It's really important, this project particularly, that we have the voices of our First Nations people heavily involved in what we're doing here, because we're talking about children and young people across the country. And, we're really keen on having everyone's voices heard and honouring that. So it's great to be here today. I'd really like to thank the Ian Potter Foundation, who have been so supportive of the vision that we have had for so long now. In fact, it's probably about 10 to 15 years since we first had the idea about the value of geographically mapping data on children and young people. And it started off small, with Western Australia, geographically not that small, but the Ian Potter Foundation saw our vision and helped us make it come to fruition and come to light, which then led to our success with creating the Australian Child and Youth Wellbeing Atlas. So thanks again to the Ian Potter Foundation and also the Australian Research Data Commons. So today we're going to be talking about the Atlas, and we'll be giving you a bit of a demonstration about the Atlas. But first of all, I'll just go through a bit of background about the Atlas and what we see its value and where it sort of came about. So really, this whole project is about the power of data. Some of you may have worked with data, some of you may have data anxiety, which is a term we've heard recently. We really wanted to make data accessible and usable for everybody, regardless of where they are sitting and what it is that they need the information for. Really, ethically, I think that data on our children and young people should be made available to people for evidence-based decision making, and it should be available free. So it really needs to be accessible and usable in a user-friendly way. So I'll just quickly flick through a few slides. I think it's really important to first off note that this is a huge collaboration and partnership between partners across the country. So the Ian Potter Foundation have been with us from the beginning. As I mentioned, the Australian Research Data Commons funded the creation of the Australian Child and Youth Atlas with the Ian Potter Foundation. And we have partners with Queensland University of Technology, who have had a really key part to play in the development, as well as ARACY. And as you can see, there's a number of different partners on this slide, probably a few that we may have missed, but it's a really strong partnership. It's basically a coalition of the willing of people who are, policymakers, government agency representatives, clinicians, researchers, advocates from across the country. So the Atlas maps data on children and young people across the country, aged 0 to 24. It's free, so you don't need to sign up. You can just go onto the website and get your access. So it's freely available and it's holistic. So it really came about after working, I've worked for a long time with administrative data sets from government, and trying to get access to those data has proved very difficult over a very long period of time. And it's extremely not cost effective, because you have people there for years trying to get access to children, young people, and we see children not as silos. Government works within silos often, so within the health department, within the education department, within child protection, for example, but children are holistic. They sit across those silos, and in order for us to properly understand children, young people, and see what's happening to our children, young people, we actually need access to that data across those jurisdictions. So we're really trying to break down those barriers and enable access to data. Another thing that we have found is that visualisation of data makes it a lot more easily understood. So, as I mentioned, people with data anxiety, you put the data on a map, you geographically map it, and suddenly things make a little bit more sense. And that's what we're really about. We're also about enabling the analysis and the monitoring of health and wellbeing metrics for children and young people. Okay, so I think I've probably already addressed all of this, but really, I think it's about ethical access to data on children and young people across the country, and it's really about enabling access to data that can make evidence-based decisions. So, if you need to know where resources should be put, then how can you make those decisions if you don't have the whole holistic picture of the health and wellbeing of children and young people across this country? And we know that significant FTE is expended, whether it's within government or NGOs or communities trying to access this data, and also small community organisations and communities themselves generally can't get access to a lot of this data in a meaningful way. So we're trying to change that. So access to these data will enable policy investments and planning at all levels, enhanced evidence-based decision-making. We can monitor the health and wellbeing of children and young people. In some instances, we have data going back 20+ years. So it enables us to look at trends and see what's happening, what's going up, what's going down, and where, so that we can, others can adjust resource allocation to where they're really needed, promote cost efficiencies, increase accountability and transparency. So this is one thing that we're really passionate about with the Atlas is around that accountability and transparency. If you have on the Atlas, a very clear vision where you can see there's children, young people who are struggling on a number of different areas and domains in particular areas, you can't deny that information is there, it's available, it's accessible. So it enables us to advocate for those areas, advocate for those children and young people, and really, increase the transparency around what's happening. We can detect emerging trends and address child health needs. We can evaluate things like the impact of COVID-19, and really the overall goal is to improve the health and wellbeing of children and young people in this country. So I think I've already, mentioned around eliminating the obstacles that hinder equitable access to data. Where we've had to pay for some of the data, and you could argue whether that's ethical or not, given that it is data on our own citizens. But we're really trying to break down those barriers and foster an evidence-driven environment for monitoring health and wellbeing, and create really strong partnerships of state and national federal organisations who really have the same vision in mind, which is to have happy, healthy children, young people in this country. So the Atlas utilises GIS, so Geographical Information System technology, to map the data on children and young people. Just in terms of privacy, no individual data is displayed in the Atlas. So we demonstrate the data, we display the data by levels of geography. So the smallest level of geography is what's called the SA2 or Statistical Area 2, which is around about a suburb level. Then some go up to Statistical Area 3, local government, or somewhere at the state level. So as far as possible, we have got data down to the SA2 level, but it really depends on custodians. And this is a piece of work that is ongoing, really trying to get down to that lower level of geography, the SA2 level, ideally. When we find we have small numbers or low counts, we suppress those numbers or aggregate up in terms of geography, and we withhold rates where they're particularly small and therefore potentially identifiable. In terms of the indicators in the atlas, we have over 500 data sets now in the National Atlas. So you can imagine the amount of work that has gone into that. And we define children's health and development around the NEST framework developed by ARACY. So there's the 6 domains: healthy, material basics, valued, loved and safe, learning, participation, and positive sense of identity and culture, and noting that there is soon to be probably a 3rd domain, which is environment, which will be added. So we have the data that we have received and uploaded, we have allotted to one of those 6 domains. This just gives you a little bit of an overview of the types of data that we have in the atlas. So, for example, in the healthy domain, we've got information around health at birth, immunisation status, physical health, mental health, injuries, estimated residential population, substance use, births, material basics. We've got information around advantage and disadvantage, housing, valued, loved and safe, family composition, family conflict, youth justice, learning. We have information on the Australian Early Development Census, NAPLAN scores, school attendance, identity and culture and participation. You'll see we're sort of short on data in those areas. So we have a little bit of information, but not as much as we would like. And I think one of the things about the Atlas is that it can help us advocate for the collection of data that is important to children and young people, but that we do not have actually in this country at this point in time, or we don't have access to. This slide shows that the governance structure of the project. I'll just gloss over this, but basically we have a partnership group which has a lot of members from the project, and we have an oversight group which is more about the sort of strategy and advocacy function, which has members from each state and territory. And then we have a number of different packages, so sort of work packages. And I think it's really important to note that we have a children and young people advisory group. And we also have a First Nations data, governance and sovereignty working group as well. So what I will do now is move my screen so I can give you the live demonstration. So if you can just go to australianchildatlas.com. So as I said, this is freely available and you'll come to this website here. So here we've got the Australian Child and Youth Atlas platform. So that's the main atlas. Here is a data dashboard where you can actually explore some of the data and download some of the data. And this is the WA Child Development Atlas platform. Now that all of the data from the WA platform is now included in the national platform, and this one will be being decommissioned shortly. We also have information on this website around the indicators. So for example, if you're looking at the themes, you can click down here and scroll to, let's say you're interested in healthy, health at birth. It will tell you a little bit about the indicators here and has some information around the policy context. And this is really important so that people can actually say, well, why would I be interested in health at birth? And it can tell you a little bit about some sort of summarises research around, why this is important for us to be looking at. For our technical information here, which is important, we have an overview. So we can look here at metadata. So if you're interested in additional information for one of the indicators, you can go to this document here and you can search for that indicator and it will provide you with more information. You can click on here to look at information around statistical areas, which will give you greater detail about that, and licensing and attributions. And then we also have a resources and user guides, which will be particularly useful. So if after this demonstration you feel like you'd like to see a little bit more around how you can use the Atlas, there's a little video here that you can play. It's only just over 3 minutes long. And there's also sort of like some slides here that you can flick through that also will walk you through the actual Atlas and how it works. So you just click on the link here. And for those of you who do it the first time, the first thing that should pop up is this screen here. Now, this explains that the data are mapped on a national scale. So if something is higher than the national average, then the colour is around that sort of pinky, reddy, orangey colour. And if it's a lot lower, then it's sort of the bluish colour. That doesn't mean it's good or bad. It just means it's higher or lower. So, for example, if we're looking at something like preterm births and we see really high, like pinky kind of colours, it means that there's a high number of preterm births compared to the national average. Which is not really what we want to be seeing. But if we're looking at something like NAPLAN scores, average NAPLAN scores, and you see a lot of pink, that means that those scores are higher than the national average, which is a good news story. So it's just really important to remember that the colours don't represent good or bad. It depends upon the data that you're looking at. If you then click here, this shows you information around the Atlas menu. So on this bit, the themes, this will take you to the ARACY Nest domain themes, so the healthy, material basics, etc. You click on this one here, which is the little thumbprint, and you can toggle between age and gender. So some data sets are disaggregated by gender and different age ranges, but some are not, so you just have to sort of explore a little bit there. This one here, the calendar, gives you the date ranges. So the years that the data are available should be sort of highlighted, and it should come up with the latest data available. So in this case, 2021. The map of Australia is what you use to look at the levels of geography. And again, the different data is displayed at different levels of geography. So that the levels that are available should be highlighted. And this one here gives you information around service overlays. So I'll show you on the actual map, but you can click that on and say, click on hospitals, and it will show you where the hospitals are, or schools, and it will show you where the schools are in that area. And this is the map interactions here, which I will walk through now. So you're on the landing page here, and the first thing that comes up is number of births. So you can see down here, this is where your indicator information is. And if you want to know where that data came from, you can see it came from the Australian Bureau of Statistics, Births Australia 2021. So you can just click on any area that you like. Let's go Wagga Wagga. Click on that area. You can see here, this is the number of births in 2021 at the statistical area 2. And then you scroll down here, and this shows you the national distribution. So this is where you've got really low numbers of births all the way. So here we've got Wagga Wagga, it's showing us where that black dot is. If you wanted to look where you've got really high numbers of births, you can click on that, and it will tell you there's one area with that really high number, Wallet. Hopefully I pronounced that correctly. And you can fly in the Wallet. And this will show you the time series, so the data over time. So you can see in 2013, there were 98 births. And in 2021, there were 549 births. So that's quite a steep increase in births in that particular area. Another really important and very simple piece of information is simply the number of children and young people in a particular area. So if you want to know how many children and young people aged, let's say we want 0 to 4, you can toggle this here. And then we'll just go down here. oh, that's single year. So if you want it, you can choose single year or you can choose year range. So this is 0 to 4. And that's both genders. And you can just click on a particular area. And again, you'll see the national distribution here. We want to see where we've got a lot of 0 to 4-year-olds. You can see Riverstone, Marsden Park. It will fly us over there. And we can see here, it's a very stark increase here in children, young people in this particular area. So nearly 7,000 in 2021 compared to 700 in 2006. And this information, although extremely basic, is really, really important for service planning. So where do you want to put your schools? Where do you need your childcare centres? All those sorts of things. So it's really, although basic, the first place really that you can actually see that information on a map and use it for planning purposes. So now we'll go down to something like, we would go to healthy. If we look at health at birth, okay, so let's look at low birth weight. So birth weight under 2.5 kilos. So we know that birth weight is an important indicator for children's health and wellbeing and for their future. So we can look here. So you can see that that's gone to 2013. We want to go to the most recent data available. So I think it's 2019, looks like it. And so we can see across the country the significant variations in the percentage of births that are preterm or are low birth weight, sorry. So if we click on this particular area here, where we're seeing quite high numbers, we can see how that area is tracked over time. So it is actually decreasing, which is the direction you want it to go in. This is why it's really important to be able to see data over time to see that actually it is heading in the right direction. And then if you wanted to explore, say, somewhere where you've got really low numbers of low birth weight babies being born, you can see, say, Blue Mountains. And we've got very low numbers. In fact, 0%. And you can click on any that you're interested in. Okay, so if we go back to health at birth, if you want to look at something like preterm birth, so babies born less than 37 weeks, again, you just click on that, gives you the latest data available. You can see this is at statistical area 3, and it will show you the variation across the country. Take you to West Arnhem and show you how that's changed over time as well. Okay, now if we want to look at something around learning, for example, so the Australian Early Development Census, I know a lot of people use that as an indicator for children's general sort of health and wellbeing. We look at combined domains. So if we want to look at children who are developmentally vulnerable on 2 or more domains. We scroll out. This is available at statistical area 3. And statistical area 2. Now, what you'll see is when you see this sort of blue and grey stripe, that means that the data have been suppressed. So it means the numbers are too small to display. But you can see the variation across the country in terms of number of, percentage of children who are developmentally vulnerable on 2 or more domains. So if you want to look at your national distribution here, go to where children, a lot of children or a huge percentage of children are developmentally vulnerable on 2 or more domains. You can click on that and fly you over And again, it will show you that trajectory over time for that particular area. So you can see that that's actually going up a bit, which is not the story that you want to see. Now, I just wanted to also show you, so if we go back to learning, and let's say we look at average NAPLAN scores, so I'll just choose reading. So you can choose years 3, 5, 7 or 9, let's say year 3, and this is compared to the national average. So you can click on a particular area. So you can see here long reach and where they sit on the national average, where you've got really high scores, high average scores or low average scores. And again, West Arnhem. That really gives you that in-depth information. If you're interested in where the schools are, you can go up here to this little icon and you can click on schools. You can see there's a lot of dots. So you have to sort of zoom in really, really, really far, and then it will tell you what school that is. So Julia Creek State School. But it gives you an indicator of where the schools are located. And then you can toggle that off. Turn that off there. And the same for hospital services or childcare centres, general practices, example. Now, another example that I think is really interesting is immunisation. So this is, if you want to look at the percentage of kids who are fully immunised, so kids who are fully immunised at 1 year of age. So this is where you want to see everything ideally to be pink. We look on the national distribution here. We do have some areas where we're seeing lower numbers of children being fully immunised. That's the high numbers. And then lower numbers here. So it's showing that in this particular area for 2018, there were 80% of children were fully immunised at 1 year of age. And that's something that we would like to see obviously increase. You can see that that's actually slowly decreasing over time. But in terms of preventable illnesses, this is something that, an advocacy or, some sort of a program in those particular areas to increase immunisation for young children might be helpful. I'm just trying to think. If we go back to learning, we can see information on school attendance as well. So we look at all schools, total rate. So where we've got high, which is what you want to see, kids attending school, and then you can see the variations. So some areas where we've got lower percentages of kids attending school and the majority is high. So some data we only have for Western Australia, and that's because we've been able to access state-based data sets from WA, and that's our plan for the future for the rest of the country, is that we can get access to those individual data sets so that we can get down to lower levels and actually map some of the data that we don't currently have at a lower level, particularly things like hospitalisations by type of hospitalisation. So we're looking here for ED, emergency department presentations for mental health related disorders in WA. So we can see here that we've got, quite a high percentage here for the Kimberley area. So you can see that that's a concern and something that, would likely need to be addressed. And then I was thinking what else I can show. I think so the hospitalisations, So it'd be good to give you just one example of how people have been using the atlas. So if we look at WA, and I think this should go there.
Yep, you're in it. It's showing oral disease related.
Yeah, it should. If I go to SA2, for some reason it's not giving me the.
So the difference, perhaps I'll jump in right back, is finding this. So because we're dealing with very small numbers, as you can imagine, looking at the population, 0 to 4-year-olds, so often we have to show 3-year or 5-year moving averages. And so often for SA2, which is a very small area, we have to look at 5-year moving averages, whereas for SA3, we look at 3-year moving averages, so a shorter time period, so to speak. So that's some of the differences in the data. If you think you're looking at, this thing is here twice, but that's because for different geographic areas, we have to aggregate and treat the data differently because of the small numbers.
So here, for example, you can see alcohol-related admissions for 15 to 24-year-olds, and it's got 3-year prior moving average because the numbers would be too low to display. So we can see here, this is children aged 15 to 24 who've been hospitalised for alcohol-related issues across the country. So you can see that there are particular areas where that is of concern. Having children and young people hospitalised for alcohol-related issues is not a great story.
This is the bit that we're wanting to show you. As you can see, large areas here have very low counts, therefore in the blue stripy pattern suppressed. But if we just look at down here, this is the area of Curtin. It's just loading here. Curtin, as part of their early years initiative, have been looking at key priority areas for their forward planning for the next 5 and 10-year plan. And they have identified early child health as one of the absolute key priority areas. And they have accessed a lot of data from the WA Child Development Atlas, which we now have in the National Atlas. And what they could see, and this is just one example, when looking at oral disease-related admissions for 0 to 4-year-olds, they could see that this says national distribution, but it's only WA distribution because it only shows WA data, that they were sitting there right at the top with the highest rate for oral disease-related admissions for 0 to 4-year-old children, which is very early. So this was one example. There are others, and what they have done with this information, they have obviously looked into the issue further and found out that there were no public dental services available for families and carers in that area. And so they used information from the Atlas to put into grant applications and in their funding applications to have dental services, free dental services visit the area, such as a dental bus. Just as an example, simple, because they were able to illustrate and show where they were sitting on the chart WA-wide and show that that was a real problem for their area. Beck, I'll hand back to you.
Okay, thank you. I'll share again. Great. Thank you. Thanks, Keta. That's great. And so also another thing I think that's really interesting is if we're looking at levels of advantage and disadvantage across the country. So if you look at index of relative socioeconomic advantage and disadvantage across the country, you can see the variation here, which enables us to really hone in on those areas that are economically advantaged or disadvantaged. So in terms of determining where you would like to put in a program or an intervention, the Atlas enables you to not only look at the levels of advantage or disadvantage within an area, but also the health and wellbeing of children within that area. And you can scroll in and see. And you can also see how it's changed over time, just like those other indicators. I'll tell you there's 30 areas that have the same rating. So now what I might do is just quickly flick back to the slides. So in terms of the future, we've got a lot that we want to do. we firstly need to secure new funding. Thanks again to the Ian Potter Foundation, who are keeping us afloat. And we've been working, talking with a lot of people to try and get funding. We've put in a Medical Research Future Fund application. We are also, the overall plan is to get the state and territory data like what we have for WA, so down to the SA2 level where possible, but just really more data. We need to establish a robust Indigenous data governance structure for the Atlas. At the moment, the data are not disaggregated by Aboriginality. We do have ethics approval from the WA Aboriginal Ethics Health Ethics Committee for the WA data, but we will be working with our First Nations colleagues to do that appropriately across the rest of the country, and then we'll be able to disaggregate. There's a few things that we'd really like to add in terms of the functionality of the Atlas. So we want clients, so people like yourselves, to be able to upload your own data into the Atlas and display that. And whether that's done, in a private way, which I think probably a lot of people would want, but we want to include that functionality so that you can keep your own data private, but you can actually overlay it and see how it's sitting against all the other data we have. We want to make some of the display panels movable and expandable. We want to be able to overlay some of the indicators and integrate the data dashboard. So on the website, you'll see that there's a data dashboard. There's a lot of information in there, so you can go to a particular area and actually download a lot of the data. But we would like that integrated into the National Atlas as opposed to being a separate function. And one of the other things that we really want to do is to create this reporting function that we're working on at the moment. So you could go to the area that you're interested in and basically press a button and it will pull up a nice little infographic. Like this looks a little bit fuzzy at the moment, but hopefully you can get the picture of what it is. So it's sort of just a data snapshot or sort of an infographic for a particular geographical area. So you can see, for example, the number of children aged 0 to 4, how many births per year, the percentage of kids who are immunised, an average NAPLAN scores, percentage of babies born low birth weight, etc., etc. But so that, you can basically press a button and that beautiful little infographic will pop up and enable you to then get a really nice picture of the children and young people in the community in the area that you're interested in. And then if it's around going to funders or looking at how the children and young people are faring in that area compared to, say, 5 years previously, that you can do that. Look at that in an easily understandable way. And I think that's probably... Oh, that's just another example of one of the areas, the Rockingham local government area that we also did that for. So yeah, just really encourage you to all go onto the website and explore, have a play around. We're doing a little bit of a seeking feedback from people at the moment. So because we've only just recently launched, we want to know what people's feel is for it. So we should note that the design of the Atlas came about after, I think it was about 10 or 12 different user group discussions and consultations, and but we're sort of continuously seeking feedback around the user experience and how we might be able to improve that. Kenna, was there anything that you wanted to add?
I think let's see what people are interested in. We can elaborate on any of the points in the Q&A just to give people the opportunity to ask.
Great, so open for questions.
Great. There was one question put forward around a filter for data for Aboriginal and Torres Strait Islander children and families, because someone's noticed that we can filter by gender and we can filter by different age groups, however, not by Aboriginal status. So the reason for that is that in the Atlas prototype, we have not yet disaggregated for First Nations children and young people. This decision arises from an awareness that across the project team and our oversight group, we all have that commonly what we see as an inadequate representation of wellbeing outcomes for First Nations children and young people. So prior to us incorporating this data, we intend to establish a robust Indigenous data governance structure. Beck has mentioned at the start when she showed the governance structure that there is an Indigenous data sovereignty working group. So this working group will, over the coming months, develop a framework that will give us guidance as to how to meaningfully include data for First Nations children and young people. Beck also mentioned that whilst we do have ethics approval for inclusion of Aboriginal data for WA, we just don't want to sort of jump in and start doing something for one jurisdiction. So we just want to have a framework that looks at this issue, which is really, really important across the country. So that's the answer. And then I think there was a follow-up as to how long this process will take. And that is difficult to answer at this stage. The working group will do their work, and once we feel we've come to an agreement across all the stakeholders, we will put that in place. Beck, did you want to add anything to that? It is a very important question.
Yes, it is really important. No, that's great. But we need to do that properly, and we've heard very loud and clear, that people do not want this deficit-based kind of narrative that we're seeing around First Nations children, young people, and so that's why we've got to be really careful with how we do this. So I think that there's a question here from Andrew. Yes, you've rightly acknowledged the issues related to organisations holding information. Do you think we can really counter this? Is there appetite from government to release their data? Andrew, yes, I do believe so. There's been a lot of enabling legislation of late that has facilitated and will continue to facilitate the release of government agency data. Within Western Australia, we were asked actually to be the first research project to access the new Department of Premier and Cabinet's People WA dataset, which is a linked data repository on everyone in Western Australia. So we've actually just got all of our approvals through this week. So we'll be going into that system and updating the WA side of things. So that's the WA government asking us to do this. This week I've been asked by the WA government to present to the WA Medical Research Strategy Group around emerging trends. So I think that there absolutely is, and I know that there's been work going on in other jurisdictions around the geographical mapping of data on children and young people. We have included some state and national organisations in our partnership groups. So we're definitely working with government on this, and I do think I'm convinced we will get there for every state and territory like we have got with WA. So someone said, just to clarify, the infographic function is in development. Yes, it is in development. Although I think that we'll probably have, what's your...
It's pretty close. It's pretty close. So we're working on it's the data automation to read from the platform. We already have several prototypes. What we need to do now is make it look pretty, really. The back end, the gritty sort of coding is all done, but it just doesn't look quite as finished as we would like. So there's a lot of design front-end work that needs to happen, but that is close.
So provide idea of the funding required. Yeah, so look, we've sort of tried to figure out what, our ideal scenario is that we would have a person sort of in each state and territory who would really facilitate the access to each state and territory's data and work with the data custodian, so have sort of a node for each state and territory, and we would have our developers and then our data scientists. So the ideal scenario is around, I think it's about 2.5 million a year for 3 years, and at that point we would have the gold standard, and then ongoing would probably be about 500,000 to 600,000 per annum to get the data updated annually on an ongoing basis and continue any other developments that need to happen. Is easy accessible data over multiple years? Yeah, so you can go into a particular area and click on the AEDC, and then it will show you for that area what the data was for the previous years.
Yeah, maybe that was just underneath, where on the right-hand side where the navigation panel is and the results panel, further down is the time series. And so for the AEDC, it shows 2009, 12, 15, 18, 21.
If we have additional data sets, is there a process of getting that included? Yes, so absolutely. So I know a lot of people have great data, and we are constantly seeking new data, and there is certainly, if you have it if you've got information around the spatial information, so you've got GIS information, then we can map it. Yeah. But as we mentioned, there are some, we've spoken to quite a few people who want to upload their own private data, and that's a functionality that we would be able to develop if we got our, you know, our core dream funding, I suppose, our optimal funding. People in the departments not enacting legislation. Yeah, I mean, look, there are certainly some agencies that are more risk averse than others, and that's something that we have absolutely overcome. Hopefully, with the new, you know, the Office of the National Data Commissioner, we can raise those issues with her, I believe. So if we have been told no, that we're not allowed, they won't give us data, we can raise that with her. Whether it means we still get it, at least we have a mechanism to raise our concerns and increase the advocacy. But I mean, you know, I've worked with government agencies for about 15 plus years now, and it's a lot of it is about relationships. So, you know, it's around enabling that trusting relationship. I think the fact that we've already broken down a lot of barriers in Western Australia has been really helpful for us across the rest of the country, because, you know, we've done it in WA, the world hasn't exploded, nothing terrible's happened. In fact, people are now using evidence to make decisions. So I think we've got some good examples.
Perhaps to mention that the oversight group and the partnership group consists of high-level and senior representatives across all jurisdictions, and the approach for each individual jurisdiction will be from that jurisdiction. So it's not that, you know, Beck or WA-based people will be the only people leading those conversations. So we're keenly aware that this needs to happen from within. And those relationships that Beck just mentioned, they need to be established and the trust has to be there. So, yeah, it will be a multi-pronged approach across all jurisdictions. And we've already started this work through the oversight group.
Well, thank you so much, Marketa and Rebecca. I think that seems like that's all of the questions, unless any further pop up in the chat box. The one thing to mention that didn't come up at the start is that this session was recorded, so hopefully there are no issues with that. If you have any issues, please contact the Potter Foundation directly. The other thing to say is that if people have any further questions, they're very welcome to contact Rebecca and Marketa directly. They've got their info email address at the bottom. I would really highlight that we think the Atlas has huge potential. It's just launched. It's very freshly launched. There's a lot more functionality to come, particularly the infographics we think would be really useful for a lot of community planning. So if people want to watch this space, there's a lot more to come over coming years and months. Rebecca and Marketa, was there anything further that you wanted to add from your end?
No, just thank you for hosting us. And, you know, we really encourage people to, you know, go on there, have a play, have some feedback, even if it's just a dot point saying this is annoying, you know, can we have this? And also share it, you know, let people know that it exists, because, you know, the more people using it, the better it is, and also the better the feedback is that we get as well. So, thank you.